Hello, good afternoon to everyone, and thank you so much for joining us this afternoon. If you have joined us before, we thank you for returning. If you haven't, my name is Dr. Sarah Modri, and this is Baby, Child, and Co. Along the way, I'll explain more about what we do. But our guest today is pharmacist Obidia Sianeke. She's a senior pharmacist at the Children's Block Kolebu Teaching Hospital. She's headed the unit for so many years. She works with so much passion and so much zeal. And that is why I thought that she's one of the best people to talk about the things that we should know as parents about medications when it comes to children. Indeed, we've talked about many things, but we have not dealt with medication. And that is interesting because medications are a core part of our work. So pharmacists are a core part of our work. So this afternoon, we are talking about medications, the do's, what you should do, and the don'ts, what you should not do when it comes to medications among children. Just give me a moment to share. And I've seen those of you who have just joined us, kindly share to your walls and to your groups so that people will benefit as much as possible. So just give me a moment to share, and then we begin. So I'm sharing, and in just a moment, I will be done. Yes, so I've just done that. Thank you so much for waiting for me, and sorry for keeping you waiting. So I've just done that. If you have joined us, you are free to ask questions. Anytime you have a question, just put it in the comments and we'll address it for you. So pharmacist Obidia, I'm so used to calling her Auntie Obidia because she's like a mother to all the doctors in the department. Okay, so I think I should just say Auntie Obidia so that I don't have to think before I talk. So Auntie Obidia, thank you so much for coming. When it comes to medications among children, what do you wish that we would know as parents? And if there's anything that you think practitioners should know as well, there are some parents here who are practitioners, so you can also chip in that for us as well. What do you think we should know?
Thank you very much, Dr. Wodri, and I thank you very much for this opportunity. And I'm happy today we are going to talk about medications, do's and don'ts. I'm sure some of you are wondering why this topic. I must say that knowing the do's and don'ts of medications helps a lot. We all know that medications play an important role in the management of our diseases, but if they are not taken well, or if they are not adhered to the way they have to, it can rather cause harm. And I'm really grateful to you for this topic. So we'll talk about the do's first of medications. There are some things that we need to know before we give medications to our children. And the first, I must say, is for every parent or caregiver to know the name of the medication you are giving to your child. Why is it important to know the name of your medication? There are times that your child may be having a chronic disease, so that child may be on some medications at home. Your prescriber may not be aware of that. So if you know the name of that medication, you can draw the attention of the prescriber to it. Oh, my girl is on this medication. So that when that prescriber is prescribing, the prescriber will have it at the back of their mind that if I give this with what she has at home, there won't be what we call drug interaction. There are some medications that when you take them together, instead of them helping the child, it can rather cause harm. It's not every drug that you can put them together and take. So if you know the name of the medication, you inform your prescriber so that They know the right medication to add to that one that the child is already taking. Apart from that, your child may be having some allergies that maybe the new prescriber may not be aware of it. So if you know it and the prescriber prescribes medicine A, you can tell that prescriber that, oh, my child reacts to medicine A. And that will help the prescriber not to give that one, but give another medication. The second is to know why the medication is being prescribed. If you know why a medication is being prescribed, as a parent, it will make you adhere to it. It will make you give it and give it well. If you don't know why, definitely you will not worry yourself. And you say to yourself, oh, why even worry my child? Especially when the medications are not sweet and they are bitter. You may end up not adhering to it.
Okay. So let me interrupt you here. You've said some things that are interesting, that we should know the names of the medication, especially if your child is on a chronic medication. So just to give examples, there are some children who have problems with the heart, children who are born with hole in hearts. A lot of them are on medication. There are some people who have kidney problems, maybe nephrotic syndrome or kidney failure. A lot of them are on medication. There are some children who have some lung issues. They are on medication. Sickle cell, I forgot, our common sickle cell. It's so common. That's what I mean. Not that the disease is not a problem, but sickle cell is very common. They are on medication. So you said parents should know the names of the medications. But what I want to say is that a lot of times our parents feel very, they feel laid back to interact with us, because a lot of them feel that when they question us, we may get angry. And I'm sure some people may have had some bad experiences that led them to have that conclusion. But I mean, we are not supposed to get angry. The healthcare worker is not supposed to get angry. And it is your right as a parent to know what is wrong with your child, why the medication is being given. So I am very happy when I am asked, because it always presents the opportunity for me to explain further. So I think parents here, just know that it is your right to ask and to know, and don't feel shy about asking or about ask anything, basically. Ask anything, and then the opportunity will be presented for the prescriber to explain more for you. Yes, before I rudely interrupted you. We can go on.
The third thing is to know if how it should be taken. Okay, there are medications that are taken at a particular time of the day. We have some medications, they cause drowsiness. They make your child feel sleepy. Such medications are normally given at night so that the child won't go to school and go and sleep over there. There are others that also works better in the morning. So as a parent, you should know when you should give that medication. It also helps you to plan so that at that particular moment, you'll be around to give the medication to the child. The
But
fourth point
sometimes
is,
they just tell us once a day. So when they say once a day, what should we do? When they say once a day, should it be morning? Should it be afternoon? Should it be night?
Thank you very much. With once a day medication, it also depends. There are some medications that makes the person urinate a lot. So if it's a once a day medication, I would advise that that medication is taken in the morning so that it doesn't interrupt the child's sleep. But if it hasn't got any of such side effects, you can take it at any time of the day.
Okay, thank you.
Then how it should be taken. There are times that you are giving medication. On the bottle, they indicate how it should be taken. If it's a syrup, they will indicate the volume that you have to measure for your child. As parents, we have to adhere to the required volume. There are times that we are so anxious. We want our children to be healed faster. So maybe if the prescriber says 2.5, you say, if I give 5 ml, if I double the dose, yes, it will clear whatever is in my child faster. But please, it doesn't work like that. You have to adhere to the required dose or the required number of tablets that your child has to take.
What happens if you
Then,
take an overdose? If you want the child to get fast and you give 10 meals instead of 5 meals, what will happen?
there is something we call side effects. And with children, most of the time we use their weight to do our calculations. So if we have checked the child's weight and used it for our calculations, and you go and give something more, remember that child's systems are not well matured. So it will not just cause harm, sometimes it can kill the child. So we have to adhere to the doses that our prescriber and pharmacists give us.
Thank you.
Then we should know how it works. How does this medication work? There are some medications that you have to take before food for good absorption. Others, you have to take it after food. You have to adhere to it. If the child hasn't eaten and you give that medication, remember, it will not work as we want. And at the end of the day, you are expecting that child to recover, but the recovery will delay, or it can even worsen the child's condition. So it's important to know how it works.
Okay, so I believe we are not going to give ourselves our own prescriptions, but just because we are learning, can you give us an example of a medication that should be taken on an empty stomach? Because I think we all grew up with the idea that you must eat before you take the medicine.
Yeah. A drug like TB medications, they are normally taken on an empty stomach. We have some children have something we call gastric pain, and they have medications that they take 30 minutes before they eat. So, like Nexium, maybe New Gel, they are normally taken 30 minutes before food. Yeah.
Okay. Thank you
Then,
so much. We have a comment coming through. Let me just highlight that one. The comment says that there are some health workers who will take their time and explain. Others feel reluctant and they are left with Dr. Google. And sometimes it is information overload. It's very true. I've had patients who've been to Dr. Google even before coming to me. And I mean, it's a good thing. I always encourage it. But sometimes it just makes patients a bit more anxious. But then I believe it is your work as a skilled provider to know which ones to emphasize for them from the Dr. Google research, and then which ones to say, oh, it's not really applying to you, and that sort of thing. There are also some medications that health workers use off-label, or like because maybe they are specialized, they use some medications, and then Dr. Google will say this one is not supposed to be given to children under 3 months. But then the health worker, by virtue of their specialty, they use it. So if you are skilled as a healthcare worker, it's your duty to even look at the face of the patient before you and know whether this patient is anxious or not. And then sometimes too, as a parent, if you think that the health worker is in a hurry, because sometimes we are really in a hurry. I mean, sometimes I want to close. I'm thinking of traffic and it is actually time for me to close. But because the patient has not had all the information that he or she requires, you see that they don't want to leave. And, and you know, being human, sometimes we also want to go. So I think the parents also need to have some tact, you know. Oh, doctor, I know you want to leave. I know it's closing time, but, and then bring it out. I mean, most of us are very excited to be able to explain to you. Okay, so like this comment, if you have a comment or a question, just put it in the box and then we will attend to it for you. But thank you for the comment.
And I must say that it is your right.
Yes.
We as health workers, we are supposed to explain it to you. And most times we are supposed to even use a language that you understand. So please, when you also come to the institutions or the hospital, don't feel shy. If the health worker is speaking English and maybe you can flow well in French, please let us know. There's always a way out. We can get somebody who can communicate with you better. Thank you. Another point is, how should I store my medication? It is very, very important. you realize that there are some medications that are kept in the fridge. And fridge underline, not freezer, where we keep our like tomatoes. We have if you want something to be ice, that is the freezer. Most medications are kept in the fridge, okay? Or the suspensions. When you reconstitute it, you open and reconstitute, you have to put it in the fridge. Please don't freeze it. Don't put it in the freezer and later bring it out. It breaks the chain, so it doesn't work the way it has to work. And some medications too are kept in amber bottles, brown bottles, not normal white bottles. Please, let's keep them there. It's for a purpose, so that the sun rays will not fall on it and reduce its potency. So when you go to a facility and you are given medication in a particular bottle, it's for a purpose. Any questions? So I should continue.
No, there are no questions so far, but if you have a question, just put it in the comments for us. And it seems there was a slight network hitch, but thankfully we have recovered. So sorry about that. All right. So you've been telling us about what to do. Yes, you've been telling us about what to do. I don't know if you want to continue to what we should not do. We've mixed in some anyway, but if there's some things that you don't want us to do.
Yes, there are a few things, but I just want to say two more things that we should do first. And it's about missing doses. There are times that you forget to give the dose at the required time. Then maybe if the child has to take it every 12 hours, you've given the morning dose, the evening dose. But maybe in the morning, in a hurry to school, you forgot. Please, don't double the dose in the evening. Don't double the dose in the evening. It will rather worsen the side effect. If you miss a dose, if it's within an hour or two, you can give it. But after an hour or two, please don't give it. Please, am I clear? The next thing is to talk about side effects. Side effects of medications. There are some medications that have side effects. Most times when the medications are being dispensed, the caregivers or mothers are taking through the side effects. Why do you think the side effects are important? Or why do you think the health worker should draw your attention to the side effects? This is because when you see it, it shouldn't frighten you. If you are not aware and you start seeing some of the side effects, you panic. We have a medication that when a child takes, the urine of the child becomes red like blood. The child can sweat and it's also red. Definitely, any parent who sees a child urinating and the color is red will be worried about it. But when your attention has been drawn onto it, it doesn't worry you a lot. Sometimes some of the side effects too, we just want you to know that when you start seeing them, you have to come back to the facility. So we tell you, and we also add to it that when you see side effect A, please report at the nearest facility. There are some that we can tell you that, oh, this one you can manage, like the urine that I talked about becoming reddish. It's the medication. So the time the child stops the medication, within a week, the urine should be clear and the person should be fine. But some will tell you to report to the health facility. And please, when you see the side effects, don't try apply anything on the child's skin. Bring the child the way it is so that we can really appreciate what we are seeing and manage the child very well.
Okay. So
another thing we must do is yes.
All right. Sorry about that. So there are some two questions and then we can quickly address them before we move on. The first one says that, can you buy medicine from a pharmacy? without prescription from a doctor for your sick child who is always given a particular medicine when he visits the hospital. For instance, we know that the example that comes to mind is asthma. We know that asthmatics, because they've been in the healthcare system for a long time, a lot of them know the medication that their child is on. So if the child is always given prednisone tablets and your child has an attack, can you go and buy prednisone tablets? But I want to use two examples. The other example would be malaria. Most of us think we know malaria, whether it is true or not. We think we know malaria. So when our child has a headache or something, not feeling well, that's what we normally say. And we know that this is malaria. Can we go and buy malaria tablet? Maybe you can contrast these situations with medications that you can purchase over the counter without prescription, like, I don't know, like a paracetamol.
Yes.
Yeah.
Yes, thank you very much. I must say that pharmacists have been given that order. They can manage diseases of common occurrence. So some of the conditions can be managed by your pharmacist. With regards to malaria, when you get there, the person has to first test the person before treatment commences. So when you are going to the pharmacy, you take the child along. But there are some conditions that cannot be managed by the pharmacist. You need labs and other things. So that is when your clinician comes in. And I must say that when it comes to that area, you have to see your doctor. So we have some medications we call prescription medications. If you come to the pharmacy without your prescription, we'll send you back to your clinician to be reviewed again and your prescription rewritten so that you can buy it. Remember, every prescription has a date on it. It has an expiry date. Some of you may not be aware of it. So when the prescription comes to the pharmacy, we really check all that before dispensing so that those who are dodging review, we just take you through counseling and let you know.
Like myself. Okay. Then there is another question. There's another question.
To say the final.
Yeah. Okay. The question says that you talked about storage of medication. And the person is asking, those of us who are in the village where there is no light, how do we store the medicine?
Thank you very much. Before we started having light, those medications were still in existence. But God is a wonderful God. We have pots, the coolers. Maybe some of you are young, you've not seen a cooler before. But some years ago, we're drinking from coolers. And those coolers, when you put water in it, no matter the days, it's still cool like ice water. So when you put maybe your child is on insulin, you put it inside there, it can go for the 3 months. And there are some medications, it's not, when we say keep it in the fridge, you can also keep it in a cool place. Okay, when we say a cool place, where the sun rays will not fall directly on it, and it's cool, like some parts of our room, you realize that in some parts of your room, some may be cooler than others. So you can keep it there if you don't have a fridge.
But this is a practical point and I don't understand. So maybe you should explain further for me, even though I profess that I came from the village. The pot, are you going to have water in it and put the medicine in it, or what are you going to do? Is it going to be an empty pot that you put the medicine in?
Thank you very much. Please put water in the pot and put your medicine maybe in a bowl and put it on the water. Yes, it will be cool and preserve your medication, especially medications that are reconstituted. They are in the form of powder. So before they are dispensed, we add water to it to do the reconstitution. You can put it in a bowl and put it in the water inside the pot. and it will be safe.
Okay, thank you. Every day we are learning something new. Thank you. All
Then
right.
the final thing we should do, please, when we are giving medications, let's complete the course. The microorganisms, now they are very strong and they are also smart. So if you are giving medications for 5 days, you have to adhere to your 5 days. Don't say that, oh, my child is better. So 2 days time, oh, the rest my child does not need it. Please try and complete the courses. It is very, very important. If we don't also complete our courses, what happens is we make the medication and the germs or the microorganisms become friends. If somebody is your friend, would you like to hurt your friend? Definitely no. So at the end of the day, instead of the medication going to harm the germs, they will rather become friends and they will live happily.
Okay. That's a very interesting way of
So,
saying it. The medicine and the germ become friends, which means that the medicine won't work anymore. And we know that long ago, treating malaria was, those days we didn't even have Ghana cities. It was the old cities. Long ago, treating malaria was very cheap. In Peswest, you could treat malaria, but now you can't treat malaria with Ghana cedis. You are even approaching 100 Ghana cedis. And the reason is what Auntie Obidia has just explained. The medicine and the germ become friends when you don't complete the course. So when you start, if the medicine is effective, within 2 days, usually it is simple malaria, you feel better, and then you stop. What is happening is that you are spoiling the medicine. Very soon, that medicine won't work. And we don't want that to happen. And that is happening to our antibiotics as well. I know Auntie Obidia likes talking about it, so I don't want to take the wind out of her sail, but just to explain. And so many people have commended us, actually. Grace Amuzu has joined. She said, excellent presentation. She's very grateful. And then there was another, I think Mavis had also made a very helpful or had commended us, but then I didn't read it. Now there is a question. It says that, I want to show it on the screen before I read it. Okay. She says, how about suppositories such as paracetamol for children? Can we put that in the freezer?
There's no need putting a suppository in the freezer. When you put it in the fridge, it hardens up. It's been made in such a way that when you keep it in a cool place, it will become hard for you to insert. And we don't want it to be blocked. Every medication has the way it works. So when you put it in the fridge and you bring it out, the way it is, the moment you touch it with your hands, with the temperature in your hand, it should start melting. So you push it fast into the anus and it's supposed to go and melt there. So you don't keep it in the freezer, but rather you keep it in the fridge. If you don't have a fridge, you keep it in a cool place where the sun rays will not fall directly on it.
Okay. Now, my own question from my experience with my children, there are some children who are very difficult to give medication to. I've also encountered children who are excellent medicine takers. They just take medicine. But there are some people, there are some children, they won't take any medicine. And sometimes when the parents, if you get upset and it's a strong-willed child, the child can even tell you, I won't take it. And it's like, I won't take it. There's like, you want them to be fine and they hate the medicine, especially if it's bitter. How do we handle that as parents?
Thank you. I must say that some of the parents are also to be blamed. There are times that you tell your child that if you don't do A, I'll take you to the hospital, they will give you medicine and they will even inject you. Please, let's not use that to frighten them. Health workers are friendly. We want to see them. We love them. So please don't use us to frighten them. And the way we communicate with our children counts a lot. If the medicine is bitter, you can communicate with the child in a way that the child will take. Then you clap for her. It's bitter. You, the mother, you know it's bitter. When your child takes it, please clap for the child. Let the child know that he or she has done well. But when we give it, oh, open your mouth, we just push it there, then we move on. Next time when you call them, they will run away and they will let us exercise. Or sometimes they will make us even pay more for the medications because there are some bottles that has the required dose per week. So if you give it to the child and the child brings it out, less than 30 minutes, you have to give again. So if you have to give again, what happens is that the volume of medication in that bottle will not last you till the 1 week. So you end up spending more. Please, let's pamper them. Let's have a way of pampering them so that they will take their medications. And when they also take it, let's try our best to clap for them. It's very, very important. Even some of them with food, there's a challenge. So let's look for a way around it so that they will always adhere to their medications.
So you've said something that is very, very dear to my heart. That is reinforcing positive attitudes in our children and listening to their voices. I always say that children have a voice. Even a 3-year-old has a voice, and that 3-year-old should be listened to. So when the child says, I won't take the medicine, you can find out why. And if there's a reason, you see how both of you can work around it. I mean, forcing, you can force a child to do many things, but medicine is not a good one because like someone just asked the question after I asked it. She's also asking anything we can do for children who don't like to take medicine at all. Also, when you forcefully give a child medicine, the child brings it out. Should we re-administer? So sometimes you give the medicine to the child. You may even force the mouth open, they will bring it out. So every child has a voice. As a parent, know how to listen to the voice of your children. And then that even gives them confidence that what they say matters. But if it's like, because you are bigger or you are stronger, you can force them to do things, it's not good. We sometimes feel that means they are respecting us, but it is not respect. That is not respect. You need to earn their trust and then you earn their respect, So they have a voice. Listen to them. Oh, why? Is it because it's bitter? Okay, it's bitter. I agree with you that it's bitter, but it's going to make you well. And when they take it, you give them some reward, like clapping for them, praising them, carrying them and dancing around, giving them a sticker. Those sort of things, they like it. Something nice that's them. It's not straightforward, like I am saying. I know that it is not straightforward, but always as a parent, you can find a way around it. I know it's not straightforward because I know that there are children who are more difficult than others. Some are docile, but there is always a way. You need to be creative as a parent. So on this point, let me ask, how about putting the medicine in something that makes it more palatable? Like mixing the medicine with yogurt that's what I can think of. Yogurt another example, when we used to eat banku, we used to put it inside the bowl of the banku and then we swallow it.
Thank you very much. Dr. Ward, it also depends. As I said earlier, there are some medications that are taken on an empty stomach. So if it's on an empty stomach, you don't add it to anything. I always believe in talking to the child. There are times that at the pharmacy, a prescription comes, the pharmacist wants to save. The prescription says oral. Oral can be a tablet or it can be a suspension. But the mother will be saying, no, don't give her the tablet, give her the syrup. Meanwhile, when you ask the child will tell you that I prefer the tablet. So mothers, I'm just pleading with you. When you get to the pharmacist and the children are being asked questions, let them feel free and talk to us. Because some suspensions are very bitter. If it's in a tablet form, it goes faster, so they don't really taste it. So if your child can tolerate maybe a tablet, and the child can take it and nothing will happen to the child, please, when you get there, let them give that safely. And also, when a child knows why he or she is taking a particular medication, they adhere. Maybe the child has body pains. Sweetheart, when you take this, the pains you're having in your body will go down and it will even vanish and you can go to school. every child will be happy to hear such a thing. So definitely the child will take it. What they don't like is when we hold their nose and try to push the medications down their throats. So let's try and communicate with them.
Great. There's another question. It says that, please, why are medicines for treatment of, say, malaria cost different prices, even though they are all malaria medicines? Why are they costing different prices? Does it mean that one works better than the others?
Thank you very much. With the prices of medications, a lot goes into it. There is something we call generic medications. Let's take it that I come up with a product. If somebody comes out with a product, that one becomes more expensive than the ones that follow from another source. It doesn't also mean that the potency is low. It is also very effective. But the one who came up with that particular product has put in a lot of things to come up with the formula. The second person is just having, it's like a t-shirt. Going to have the inscriptions written on your t-shirt. The person should first get the inscriptions. They have a way they say it. So they have it done first so that subsequent ones becomes cheaper. Okay, so the first person who puts that idea together, a lot goes into it. So that person will have it at a higher price. Then those who come and copy from the ones that are already made, they do not put in a lot. So theirs becomes cheaper. Another thing too is with the malaria medications, there are different malaria treatments and they have stages. Earlier on, we talked about non-adherence to medications, making it cause resistance. So if you don't adhere to the first line, and so it doesn't work, and you have to move to a higher product for it to work, the price will also go up. And we even gave an example with the antibiotics. You are giving antibiotic A, maybe you gave it for 2 days instead of you giving it for 1 week. And it's a habit that you have. At the end of the day, that particular antibiotic may not be good for your child again. You have to go higher. And even as you go higher, the price won't be the same like the first line. So non-adherence can also make prices of medications also go up because they have to go a step higher. And also the formulation of that product can also make it more expensive.
Okay. But I have personally gone to pharmacies before, and then I'm told that maybe this one is from UK and this one is from Ghana. And sometimes we think that because it's from UK, it works better. And usually those ones that are from UK, they cost more than the ones that are from Ghana. And sometimes you are forced to pay more and get that medication. Still on the medication issue, I believe that sometimes you want to have confidence in what it is that you are taking. Frankly speaking, because I'm a consumer of medications myself, sometimes you want to have confidence in what it is you are taking. So sometimes when it's coming from some big companies, you know that these big companies, maybe they have a reputation that they manufacture good products, because we've also heard in the news that there are some pills that are just maybe coconte or powder put together. You know, we have fake medicines and all that. So if you are buying medicine, how do you reconcile all these things? So I don't know who has left the stream, whether it's me or Auntie Obidia. If somebody can just do me a favor and put in the comments for me if it is. I think Auntie Obidia has left the stream. Can you comment? Can you confirm that for me? Okay. So what I was saying is that even sometimes when you get to the pharmacy, you are told that, oh, this one is coming from maybe abroad. And because it's coming from abroad, you tend to have more confidence in it because maybe there are some fake medicines. But in fact, okay, thank you so much. Someone says I'm on. But in fact, even those coming from abroad can be can be counterfeit. So when Auntie Obidia comes back, maybe I'm going to ask her how we can distinguish between which medicines are counterfeit and which medicines are real. Okay, all right. Thank you, Albert, for your feedback as well. Okay, all right. So Selassie asked a question which I believe we have answered already. Selassie is asking, is it right for tablets to be placed in foods like banku fufu, for example, for the child to take because they have difficulty taking pills or tablets? I believe that that question has been answered, and she said it depends on the kind of medicine it is. If it's a medication that's supposed to be taken on an empty stomach, then it's not right to put it in banku or fufu to swallow. But if it is medication that you should take with food, then that is okay as well. Okay. So while we wait for her to come back, you can still put your questions in the comments, and I will answer some of them as I wait for her to come back, and then she can take on the rest. So let me just take the opportunity to talk about what we call antibiotic resistance. Antibiotic resistance is, as Auntie Obidia was saying, that medicine and germ, they become friends and they don't work. And antibiotic resistance is becoming a very, very big problem, especially among those of us who don't have money. In the countries that are poor, antibiotic resistance is a greater problem there. But we are the ones who don't have money. We are the ones who cannot afford to pay a lot of money when our children are sick. But the cheap medicines are no longer working for us. And the reason the cheap medicines are no longer working for us, and even though we are poor, we are now going to be forced to pay more for our healthcare or for our medicines, is that our systems are so lax. Nobody checks whether, we are doing the right thing, basically, because like she said, there are some medications that are only prescription medicines. You should have a prescription, meaning that you've seen a doctor, they've examined you, some tests have been run before they prescribe it for you. So those medicines that are prescription only medicines, they need to be protected. It may not sound like it concerns you because you are just one person, but see the example I gave with malaria. Now malaria is very expensive to treat. It used to be very cheap when I was little. So let's protect our medicines by adhering to the laws. So Auntie Obidia is saying to me that I am off, and I want to just beg your pardon to message her that she should just join back in. I think she's finding it difficult to join back in. Okay, so let me just do that. Okay, I don't know why she didn't get my. Okay. I'm back now, and I've just attended to her, so she will join us in no time at all. So what I'm saying is that we need to protect our medicines, especially in countries like Ghana where we don't have money, where we don't want it to be such that when a child is sick, you need to spend 500 cedis, 400 cedis on medication. But it is our collective responsibility. If we don't protect our medicines, our healthcare is just going to get more and more expensive for us. Okay, I'm still waiting for her to join. I don't know why she's still saying she cannot find me, but I am right here. Her network probably has some issues. Okay, all right. So I think in order to save everybody's time, we have already said a lot, and then I will just thank you for joining us. And I will try and bring Auntie Obidia again because she said she wanted to talk about asthma medication, how to take asthma medication and so on. So I'll bring her again on another live show, and then we can talk about asthma. So thank you so much for joining. Just before we end the session, let me just talk about Baby, Child and Co. What we do, we are basically into child health education. We tell you everything that you need to know about your child. And we thank you too for joining. Okay, she's saying she's back. I still cannot find her. Yeah. Okay. Unfortunately, I still can't find her, so I can't bring her on. Yeah, so what we do is child health education. Anything that you need support with, we will provide support for you. So we have just upgraded our website. You should visit it. It's at babychildandco.com. You should visit it. It's very user-friendly. It has a new look, a new feel, a new face. And we have a parenting club that we are very passionate about. So for the parenting club, when you join, every month, every week, we will deliver information to your email that is specific to your child according to the age of your child. So it's not generic. We give you something that is only for your child. So thank you so much for joining. We still have about 10 minutes to close, but because Auntie Obidia has left the stream, thank you. And we are going to end now. Bye-bye.